Good Sunday morning, folks, and thanks for tuning in this morning. I hope you all are having a fantastic weekend so far. Well, if you didn't know, March is Colorectal Cancer Awareness Month, and today we are joined by Dr. Henry Herrera. You are from the Renaissance Gastroenterology, and you are a gastroenterologist yourself.
Yes, ma'am.
So thank you so much for coming in today.
Thanks for having me.
So first things first, let's talk about, I guess, your specialty. So you're a gastroenterologist. So
Yes.
for people who might not be familiar with what that is or might not have ever needed to see one, maybe you can tell us a little bit about what you kind of focus on.
Sure. So our specialty is anything having to do with abdominal pain or the gastrointestinal tract. So abdominal pain, nausea, vomiting, problems involving the esophagus, the stomach, the liver, the pancreas, the small intestine, and then the reason we're here today, the large intestine or the colon.
Definitely. And so you see a wide variety of patients that may suffer from just a different amount of symptoms of certain things. So what have you, or what kind is the first kind of symptoms that people tend to have or see that they're like, or how they get into your office,
Sure.
basically?
Yeah. So a lot of patients tend to go to the primary care provider first, and I would say by and large the most common complaint that we get is abdominal pain. Abdominal pain, nausea are typically the most common ones. So usually the primary care provider will try to give them care and see if they get any better. If they can't get better and they feel like they need some specialty assistance, and that's when they come to us.
Definitely. And so colorectal cancer, now that's what we are talking about today. Now it is March is the awareness month to kind of combat that and kind of raise awareness and have that conversation. So it tends to, I guess, give us a little bit more information on exactly what that entails as far as how we get to the point of working with a doctor, kind of.
Yeah. So we're fortunate that we have March as kind of that colon cancer awareness month, but it's important to know that obviously colon cancer can happen any time of the year. And so, really we try to spotlight this month in terms of getting the patients to know what are the symptoms, how do you get diagnosed or how do you get screened, and then, what you do about it, and then what are your risk factors. So colon cancer is expected to affect 150,000 new people this year.
Wow.
And there's expected to be about 50,000 deaths in 2019 alone, and so it definitely affects a lot of people. Your lifetime risk is 5%, and so that may or may not sound like a lot, but I would bet that most people would love to have those odds in Las Vegas. I mean, 1 in 20 is pretty high. So for that reason, we have a lot of different screening methods in order to detect these cancers, or to try to prevent them by detecting the precursors, which are called polyps.
Yeah, definitely. And so what are those symptoms that people should kind of be looking out for or be thinking of?
So the scary thing is most times patients are asymptomatic, meaning they have no symptoms. If they do have symptoms, the most common one is change in bowel habits, or patients usually went to the restroom once a day, twice a day, and all of a sudden they've noticed over the past 2 or 3 months that they're going either more frequently or they're going less frequently. So abdominal pain is actually the least common symptom, and most people would think that if I have abdominal pain, that signifies that I have something scary. Believe it or not, once you have abdominal pain, then that usually means that you've had something that's been progressing for a while, and you're either about to be completely blocked, or it's beginning to affect some other organs.
Wow. And is this something that kind of just happens genetically? Is it something that's caused by something else, or is it something that just, it can happen to at any time, anyone? So
there's a lot of different risk factors. The 3 main categories I would say would be a personal or family history of colon cancer or advanced polyps, a history of inflammatory bowel disease that includes ulcerative colitis and Crohn's disease, and then you have your genetic syndromes, and there's a ton of different genetic syndromes, but the most common ones being Lynch syndrome and it's called familial adenomatous polyposis, or FAP for short. So if you have a family history, what that means is a first-degree relative under the age of 60 has had colon cancer. If that's the case, then you actually have a much higher risk of developing colon cancer yourself, and so the recommendation is for you to get your colon cancer screening beginning at the age of 40 or 10 years earlier than your family member was diagnosed.
Wow. And so in a way to, I guess, combat it, is there something particular or things that people need to be, I know, of course, watching out for symptoms in general, and then, of course, looking at your family history to see if this is something that runs along in your family. But is there anything else that people should be doing as far as like eating a certain way, or in just general to have a better kind of gut health?
Sure. Yeah. So they've looked into what are possible protective factors. The best thing you can do is basically try to have a healthy lifestyle, and so things like diabetes, obesity, lack of exercise, eating red meats, eating processed meats. All these things can kind of increase your risk of developing colon cancer. So, eating healthy, exercising daily, those are things that somebody can do on their own to try to at least reduce the risk of colon cancer.
And so so say someone gets a diagnosis that, this is something that is affecting their life. What is the process for them? Is it kind of something that they can, is it a process? Obviously it is a process, but what kind of, I know it's probably circumstantial, of course, as well, but what is kind of how do they kind of combat it?
Well, most commonly patients will go to their primary care provider, and they'll pop in at about the age of 50 years old, and the primary care provider will say, well, it's time for you to get your colonoscopy. Now that's for average risk patients that don't have these other risk factors, family history, to name one. And so if they are 50 and they're ready to get their colonoscopy, and that's what's called a screening colonoscopy, and so we do that to try to prevent colon cancer. So patients are then referred to the gastroenterologist, and we talk to them about their medical history, make sure that they don't have any other major medical problems that would prevent them from getting a colonoscopy safely. And if we feel like they're a safe candidate for colonoscopy, then what we do is we give them some instructions regarding what to do before your colonoscopy, which is going to involve some sort of a laxative the day before the procedure and being on a clear liquid diet the day before the procedure. Once they come the day of the procedure, they make sure they come with some sort of a driver, whether it be a family member or a friend, somebody who can take them home safely, because the vast majority of the cases involve some sedation. Procedures usually take about 15 or so minutes, and believe it or not, most patients, when they get their colonoscopy, don't even remember having it. They wake up after in recovery, and they're basically like, what happened? So it's not as uncomfortable as most people think it is, or afraid that it will be. It's actually, for the most part, a pretty comfortable procedure.
Definitely. And people should be going to get a colonoscopy around, I believe, like there's a certain age of when you should be going to get it just routinely to kind of keep up with yourself.
So at the age of 50, if you have no risk factors, so no family history, no inflammatory bowel disease, and no genetic syndromes. So at the age of 50, now the American Cancer Society actually in 2018, they came out with a new guideline where they actually recommend 45 years old as the new guideline. So far that's been the only society who's made that recommendation. The U.S. Preventative Services Task Force is still at 50 years old. But if you're 45 years old and you're interested in getting a colonoscopy, what I would say is just talk to your primary care provider and have them refer you over to us, and then just make sure your insurance will cover it as a screening. I think most insurances will, but some are still, they're not required to.
Yeah, definitely. So that's probably the most important thing. Just go see your primary care doctor, of course, if you're feeling any type of way, exactly, if you have any symptoms, and then of course if they need to get referred to you all over there, and then again just kind of live a healthy lifestyle, eat well, exercise is always really important. So folks, if you have any questions or you have any concerns at all, you can go ahead and give their office a call. That number is on your screen right now. Dr. Herrera, I want to thank you so much for coming in today.
Thank you so much for having me.
Appreciate it. Thank you so much. All right, folks, so when we come back, we are talking about the Noche de Gala. We have all those details coming up. Stay with us.